Welcome to the Living Medicine Podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show.
Hey, everybody. This is Dr. Sandy Newis, and I am excited to be with Dr. Rick Barnett today. And we're here on the Living Medicine podcast. And Living Medicine, just to tell you a little bit about it, we provide training and content and resources for licensed mental health and medical professionals who want to stay cutting edge and get training and really become heavily involved in the ketamine and other psychedelic-assisted psychotherapy spaces. So I'm excited again to have Dr. Rick Barnett. And just to give you a little bit of an introduction first. So I met Rick because he's the organizer of the Soulquinox conference, which takes place in Vermont in June, and have been following you, Rick, ever since, paying attention to the things that you post on LinkedIn and in other places, and just really respect you. So I'm happy to have you here. And just by way of introduction, he is licensed in Vermont and New York and co-founder of the Psychedelic Society of Vermont. He's also legislative chair for the Vermont Psychological Association and former chair for the Vermont Psychedelic Therapy Advisory Group. Rick has been trained in psychedelic therapy and research with a focus on MDMA, psilocybin, ketamine, and 5-MeO-DMT. He has a private practice in Vermont focusing on depression, anxiety, and addictive disorder. Rick is in long-term recovery from addiction, and he is passionate about helping people achieve and maintain freedom from addiction. So welcome again, and thank you so much.
Thank you.
Delighted to have you here. So,
I'm happy to be here. I'm happy for this, looking forward to this conversation.
good. Well, thank you. So I really would love to just hear first about, what is your interest and your journey into psychedelic medicine? From what I can see, you're one of the people who has really just done a deep dive, right? That this kind of world has kind of captured you as it captures many of us, myself included. And we just keep going deeper and deeper into the space. And it seems like that's been your journey. So I'm curious what you'd be willing to share about that or interested in sharing about that.
Yeah, I think for me, it's really coming home. What happened in 2018, 2019, when I realized that psychedelic research and therapy was getting as much attention and traction as it was, I was like, holy cow, this is like a coming home for me, because when I was younger, I used a lot of psychedelics. I used them what I thought at first was spiritually, and it was life-changing, very, very profound. And then after a little bit of time, it became self-destructive. But after I changed my wayward ways as a youth, I got into trouble with alcohol and other drugs, and psychedelics were part of that. When I went to treatment and got into recovery and maintained my sobriety, I never forgot the profound nature of those experiences when I was younger. And I say to people that, I haven't been saying this publicly for a long time, but more recently I feel comfortable saying it, is that if it wasn't for my psychedelic experiences, notwithstanding their destructive nature, for me, I mean, their healing nature and self-destructive in ways for me, I would not have become a psychologist. So here I am, almost 20 years into my career as a psychologist, and psychedelic research and therapy is becoming quite a thing. So for me to do a deep dive into that world, starting in 2018, 2019, was seamless. It felt very natural. It felt very fulfilling. Is like, this is what so much of my life has been about, but not really outwardly, like inwardly, it was a big part of my life, but I would never share it. So it gave me an opportunity to train in psychedelic therapy, to learn all about it, to meet people. You mentioned Soulquinox. One of the whole reasons for Soulquinox, the conference that we put on here in Vermont every year, is because bringing people together around this very important subject that frankly expands well beyond psychedelics themselves, but just what it means to be human, to be connected to one another, to travel this journey together while we're here, given everything that's going on in the world, whether it's present day or what happened 500 years ago or what life is going to be like 500 years from now, to be part of that whole thing and to connect with each other is really important to me. So that's why Soul Equinox has been going on for 3 years now. And I love this subject and I love the ways it can help people. And that's how I got here.
I love that. You mentioned, kind of your own experience and how it branches into other areas, that it's not just, psychedelics. And I'll just add, it's not just about being high, right? I mean, that's what I hear you saying.
Right.
And kind of, branching into these other areas and, bringing that kind of across disciplines is not the word you use, but I used it. I'm just curious, kind of, how do you see that? Like how do you see it kind of crossing across domains? What domains do you see it crossing? Like, I feel like a lot of us talk about that, but I think it might be useful just to name that for people.
Oh yeah. I mean, one of the ways it crosses disciplines, I mean, it really psychedelics or the awarenesses or experiences that they can offer people tend to reveal the interconnectedness of all things. So across disciplines, there's a relationship between psychedelic experiences and philosophy. There's a relationship between spirituality, religion, and psychedelics. There's a relationship between that and psychology. There's a relationship between that and physics, chemistry, biology, engineering, art,
Yeah.
teaching. There's so many ways in which the things that can be revealed or experienced through a safe and well curated psychedelic experience. There's so many, so much interweaving going on there that it's really, again, it becomes less about the psychedelic itself and the realization of how a lot of things are connected and relate to one another. And so I think that's what I've found in my experience. And there's even I don't know if you heard of the infinite potential. There's a famous physicist named David Bohm who connected with Krishnamurti, who's a Indian mystic philosopher guy. And here we have a hardcore scientist, physics person, and a spiritual guru type person, like having fascinating conversations about the interrelatedness of physics and spirituality. And psychedelics can be sort of part of that conversation very, very easily. So that's, yeah, cross-disciplinary is definitely something that's always top of mind for me.
Well, that's so interesting. So this might feel a little bit out of left field, but it seems like a natural follow-up to what you said. I was just recently having a conversation with actually somebody who's part of our team who brought an interview with somebody to my attention, that they seem to be kind of like taking psychedelic-assisted psychotherapy and making it all about symptom reduction. And the person was like, can you believe it? It's like as if they're just like leaving the fact that we're like looking to expand consciousness just like off the table. And I'm just kind of curious if you have any thoughts about that, like that kind of reductionism and, how do we kind of hold those balances?
I have a lot of thoughts about that. But it's interesting because our Western medical model and our sort of scientific materialism, reductionistic way of being in modern society is something that, on the one hand, it would be natural for us to want to break down psychedelic experiences into, more, concrete parts and utilize them in ways to help with symptom reduction and specific things. There's even the idea and that the efforts that are going on, as you know, around taking the mystical experience out of the psychedelic and
Mm.
creating drugs that are next generation SSRIs. So there's no psychospiritual experience associated with it. Just take a medication every day that acts on serotonin receptor sites and changes the way we think and feel in positive ways, but different than our current psych meds. And that's all fine. That's all fine. And I think there's also an effort to remove the psychotherapy part out of psychedelic-assisted psychotherapy because of what happened with the Lycos MAPS trials and the FDA rejection of MDMA for PTSD, which I know you've talked about a lot on your podcast. But I try to remain somewhat agnostic about that, in that, of course, you and I are both psychologists. We believe in what we do. Psychedelics or not, we believe that talk therapy, meeting with people one-on-one or in groups, and being curious and asking questions and being present and being witness and listening and engaging in ways to help people, we believe that as a very useful tool for people, with or without psych meds, with or without psychedelics. So the fact that we absolutely have to pair psychedelics with psychotherapy seems a bit rigid as far as I'm concerned. We know that there are plenty of shamans and guides and facilitators out there who do great work. They're not doing psychedelic-assisted psychotherapy. They're holding space for people in the way that they hold space for people. So to think that psychedelics can only be taken in the context of a psychotherapeutic or Western medical model, I think is very, very short-sighted, although it is the system that you and I both work in. And so I support efforts to combine the two. I support efforts to decouple them and still offer the psychedelics in some way, shape, or form to people with support or guides or whatever. So there isn't one way to do it. What we do know about psychedelics is that they're great disruptors, and they don't give a shit about how we construct whatever systems around their use that we're going to construct. They just provide an experience. You ingest a molecule that changes the way you think about yourself, the world, other people in very, very profound and mystical ways. And if there's psychotherapy as part of that, great. In a lot of cases, it's needed to help people get through and really optimize the experience. And in a lot of cases, it's not needed, it's not required. So it's kind of a both and, I think.
That's interesting. This could go on for hours, I'm sure, but I am curious. Do you think that that there could be differences between different types of medicine? Like for example, like the sacred plants come from ancient traditions, right? Like we didn't, the therapists didn't invent that. The researchers didn't invent that. There's, like as long as there is known human history, there is traditions of working with sacred plants in non-ordinary states. Then we have other medicines that have been developed more into the modern world. And, it's a big thing in the field, right? Like which medicine for which, and is that even relevant? And so I'm just curious if you have any thoughts about that.
I think so. I mean, I think a lot of the work that's been done by MAPS over the years for post-traumatic stress disorder using MDMA is specifically, ripe for. It's unfortunate it wasn't approved, but it's specifically ripe for certainly today's day and age. All of the information we're learning and hearing about trauma this, trauma that. We've just gone through COVID. Everybody's got trauma. We've got Gabor Mate and Besser van der Kolk, and the body keeps a score, and trauma, trauma, trauma. So everything's about trauma, trauma-informed therapy. And here we have a medicine, MDMA, that specifically can be catered to all the stuff that we associated with trauma, the activated amygdala, the fear response, the lack of safety, all this stuff that MDMA seems to target specifically, and done in a curated psychotherapeutic environment. It just makes a lot of sense. Now, contrast that with ayahuasca. I don't think of like ayahuasca assisted psychotherapy. That just sounds like a wild thing to me. Like, how does that even work? I think of ayahuasca as, a month-long dieta, certain foods, you choose a plant, no sex, like a very curated thing. And then you travel somewhere. It could be in the United States, but you travel somewhere. It's usually in a group, and it's usually held by not a psychotherapist or medical person, but somebody who's experienced with ayahuasca or something like that. So, I think molecule specific, yes. And then you think about like 5-MeO DMT, which is, we can talk about some more, and maybe I'll just pause there. But 5-MeO DMT is a unique molecule in and of itself that one could make an argument for both sides, I think.
Right. So I want to put a bookmark on the 5-MeO and get to that. I want to ask you one specific question about psychedelic assisted psychotherapy. So you're a clinician yourself, and as you said, you've had lots of psychedelic experience. I don't know for sure, but I'm assuming it sounds like you've been in, ceremonial situations, and I know you've done that work with 5-MeO, and you're also a therapist, and you facilitate this conference. So I'm just curious about your thoughts about psychedelic assisted psychotherapy. Is it effective? Is it useful? How, any concerns with it? Like you already named one that let's not just assume it has to be a part of the process. And then there's the research piece that, I'm super interested in, but and have, where it's like, can we compare the two? Like, could we take a medicine and do it with or without therapy? But I'm really talking more kind of about the applied clinical pieces of that or non-clinical pieces, the growth oriented pieces. What are your thoughts? And again, positives, negatives, concerns, hopes, excitement?
Yeah, in general, I'm really excited about the progress and the growth in that area. It's important to make the distinction between clinical and non-clinical. So
Mm.
I was part of this psychedelic therapy advisory group here in Vermont. That was a state legislated group. So there was a bill called Act 126, where the state legislature here in Vermont wanted an appointed group to look at the research on the therapeutic use of psychedelics and make recommendations back to the legislature. Now, this was a group that was comprised of the Commissioner of Health, Dr. Mark Levine, MD, the medical director for the Department of Mental Health, psychiatrist, Dr. Kelly Klein. We had someone from the Vermont Medical Society. We had someone from the State Medical Board. We had a lot of medical people, and it was a group that was specifically the Psychedelic Therapy Advisory Group, looking at the therapeutic use of psychedelics. So within a clinical model, when we're talking about people who are struggling with diagnosable mental health conditions and they're
Mm.
looking for help, and we're plugging that clinical modern diagnostic system, problem identification, codification process, we're applying psychedelic therapy for those folks in a clinical setting, then I think having trained health professionals who are licensed, who know what they're doing around like good diagnostic skills, good treatment skills, good knowledge and training around psychedelics, pairing those two together and helping people in that model, that's really important. But there are people, whether they have a diagnosed condition, a mental health condition or not, who may not want to interface with the Western medical system. They don't have a very positive view of physicians or psychologists, and they want to use it in a safe and effective setting. And they don't want to be labeled as being bipolar or having an anxiety disorder or dealing with trauma in the clinical sense. They want to have an experience that is non-clinical, that is for personal exploration and growth. Again, they may or may not have a diagnosable mental health condition, and there needs to be a system for those people. Then where does the licensed healthcare professional fit into that? Because if it's not under the auspices of the system that we have and it's sanctioned, then we as licensed healthcare providers are risking our professional careers, our licenses, by working with these people outside of a legally sanctioned setting. So where do they have to go? Then they have to go to people who are not licensed. And that's fine because there's a lot of non-licensed people out there that do good work. But it's a little bit more open-ended to try to figure out who's, word of mouth, like who's a good practitioner out there, and maybe a little less controlled, a little less regulated. So, I'm a believer in both models, and we as a group for this state legislative mandate, we couldn't come to any consensus around recommending a system where licensed healthcare providers could help people with psychedelic assisted psychotherapy, because there just didn't seem to be the data and the resources that we would need to stand something up like that in a clinical sense in Vermont. And we didn't make any recommendations for a non-clinical model, the way they have in Oregon, for example, or a decriminalization model, the way we have in some states and municipalities, and what's going on in Colorado. We just couldn't do it, which I thought was unfortunate, because I think there's a way, maybe I'm idealistic, but I think there's a way to do both. I think there's a way to involve licensed healthcare practitioners outside of a medical or designated clinical setting. Like there's like a consultation model or something where that licensed professional is still protected. So they're
Yeah.
not recommending somebody go do an illegal drug and have an experience, but they're there as a support system. They're there as a consultant, that they are available as a resource for people who want to have these experiences clinically or otherwise. I think there's a way to do it.
Interesting. So I'm curious, what do you think the value added of the clinician in that setting is? Like, I hear you loud and clear that we don't always need to be clinical. It doesn't always need to be run by clinicians. And there's a gray area. So, because, I'm adding in, I don't know if you agree with this, I'm adding in because, having a license means you have an ethics board. It means that you have an assumed set of standards. There's a knowledge base that we can assume that you generally know, to varying degrees. So there is some sort of like foundational piece. So, assuming that we're in agreement of that, I'm curious what else you think about is value added for the clinician in those situations.
Because we're trained, because one of the things in all of my psychedelic training that I've gone through is that I was sort of struck by, I'm at the time I was getting training, I had already worked in the field about 20 years. So I'm
Mhm.
getting training on psychedelic-assisted psychotherapy or helping people with psychedelic experiences, where I'm learning about basically like holding space for people. How do you hold space for people? And
Mhm.
I mean, we hold space for people day in and day out. We know how to sit with people. We know how
Right.
to sit with people in crisis. We know how to sit with people who are getting hysterical and crying their heads off, or really despondent or whatever. We know how to, no psychedelics involved. We know how to sit with people. And I think that training and that expertise that comes with knowing how to be with people going through different things is really, really important and it can be applied to psychedelic. Now, psychedelics, obviously, I'm somebody who believes that clinicians should probably have their own psychedelic experiences in order to be helpful, or more helpful for people who want to have a psychedelic therapy experience. But um, I think a lot of our skills already as licensed trained clinicians come to bear. And there's ways in which we know how to spot trauma. We know how to spot nonverbal signs of distress, or we know where to ask questions where other people might not. We know when to stand back. One of the things that you have heard from Michael and Annie Mithofer, and from other people in the psychedelic space, is this idea of wait, why am I talking? Why am I talking? Why am I talking? And so many people who may not be trained clinicians, and frankly, even some trained clinicians, we can talk too much, and we need to stop and just listen and be present and know how to be present with somebody who's going through a process. And so I do think that the skills that we bring to the psychedelic space as clinicians is really important. Spotting trauma, spotting the signs of something good or bad happening, gently inquiring about it. And then also and this is maybe a little bit off topic, and I don't mean to toot my own horn, but I have a master's degree in clinical psychopharmacology. And I
No, I
really see that. What's that?
didn't know that about you.
Yeah.
I'm sure that's very informative.
It's very important because here there are people that you know and I know that are wanting to microdose, or they want to have a psychedelic experiences, but they've been on Zoloft 200 milligrams for 17 years, and they've been on this medication and that medication. They're still taking it. Should I come off of it? Should I not come off of it? What do I do? I want to try this, but I don't know about that. And having a degree in psychopharmacology is so, so useful, because otherwise you have people who are out there serving this medicine who have no background in pharmacology, and they're telling people, well, you need to come off your SSRI for at least, 2 weeks before we
Forever.
serve you
Right.
any, psilocybin. And it's like, well, let's get a little nuance here. Do you really know what you're talking about? Do you know what the research is on SSRIs and psychedelics, and what are the pharmacological properties of both, and which receptors are they targeting, and how do you work with somebody around gentle taper or titration processes and dosing schedules and stuff? So that's another piece that I think a lot of clinicians bring to the table when it comes to psychedelics. And so that's important.
That's super important because I've always wondered, how much of that is just an artifact from like, back in the day when it was all in the underground. So they were taking, coming from like these ancient traditions that with the dieta, which may or may not be as relevant in the modern world, when somebody doesn't have all that time. And then what is the downside, of getting off the SSRI that may or may not also be negatively impacting the experience? I mean, there's just a lot there to unpack. And I don't know how much information. I've actually never really looked at it. Is there a lot of information available on that? Or it seems to me like it's only just a little bit because it's not been legal. So it's harder to look at that.
Well, there's information out there. Ben Malcolm, the spirit pharmacist.
No.
Oh, you don't? Oh, you should have him on your podcast for sure.
Okay, good.
Yeah.
I'll
I'll
I'll make a list.
I'll
Good.
send you.
I'm sure you could go on forever about that, but I'm just, just kind of noticing like that is a big lack of information. Like in the training programs that we do, we don't have that information. Other people don't have that information, and I think there's a real need for it.
I have that information, and Dr. Ben Malcolm has that information. There are charts out there. I
Oh,
have
great.
charts and like taper schedules and all this stuff. Yeah.
Good. I mean, I don't advise people on microdosing for just that reason. I mean, it's not legal, it's not decriminalized in my state, and I don't know what I'm talking about. And I own, so like, I'm glad to know that you do. That's great news and, follow-up conversation for sure. So let's switch gears to the addiction recovery piece. So as I mentioned, I first heard you on a panel talk about psychedelics and addiction recovery at Soulquinox. And I kind of started, like I've worked in addiction and trauma for a long time, but done addiction work as kind of secondary to the trauma work. So I don't do primary addiction work. Like people don't come to me to get sober. They come to me after they are, kind of stabilized in their sobriety. And then we're working with the nervous system pieces. And so I've been tracking this pretty closely and I've come to a place of, shifting. I went from a hard no from safety reasons and then have been educating myself. So I'm just curious, what your thoughts are. Has that changed for you over time? Like where do you currently stand with it? How do psychedelics fit in when somebody's in recovery?
Yeah. And so, what did you mean by for a long time you were a hard no, and now
Oh,
you?
what I mean is that when I first started, like I do ketamine assisted psychotherapy. And when I first started doing that in 2020, I started training in 2019 and saw my first client in 2020. I would not take people who wanted to come to do ketamine work to get sober. Now, the psychiatrist that I work with, my prescriber, is board certified in addiction medicine, and he was very confident that we could do that and do that work. But for myself, I just think personally, from a personal and professional ethics and standards and integrity place, I didn't feel like I knew what I was doing, and I didn't know what the relevant considerations were, so I wouldn't do it until I got more education, training, and understanding, and my perspective has been evolving. So that's what I mean.
I see. Yeah. 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 So in general, it's interesting. One of my early experiences, in 2019, getting up to speed with what's going on with the psychedelic research, I heard Michael Pollan speaking at the APA convention in, I think it was Washington, D.C. That was in 2019. And Matt Johnson was the then president of APA Division 28, well-known researcher at Johns Hopkins at the time. He's now at Shep Pratt. And he introduced Michael Pollan. Michael Pollan spoke, and then they both came out on stage. And one of the things that they were both saying was that psychedelics are not only not addictive, but they are anti-addictive.
Mhm.
And it was interesting because I stood up and I said, you both said that they're not only not addictive and even anti-addictive, but my experience has been that people can get addicted to anything. They can get addicted to all kinds of experiences. There's process addictions, there's substance addictions, there's all kinds of addictions. And I would argue that there is a very small subset of people who just like to trip, and they like to do a lot of psychedelics a lot of the time, and they'll mix and match and they'll do it, and to some detriment.
Yeah.
Over time you can get a pretty washed out brain if you're doing ketamine one day and 5-MeO DMT the next day and take a large dose of LSD the next day, and you maybe take a day off, and then you have an ayahuasca experience, and all you're doing is going, day after day or every other day or every fourth day doing, or maybe using 12 different psychedelics on the same day, in a way that, in a setting that's not safe, and maybe you're getting physically harmed or compromising some aspect of your values or physical safety and stuff. So I do think there's a small subset of people that can take the experiences and run with them in destructive ways. But in general, I am somebody who sees psychedelics as being helpful in addressing people who are in active addiction and trying to help them get off of their drug of choice or their behavior of choice. And I also believe that psychedelics can be helpful for people in early recovery from addiction and for people who are in long-term recovery from addiction. It really depends on one's intention and how is the psychedelic experience being prepared for? How is it being administered? What is the support system around it afterwards? Is it part of a community support group thing that's ongoing? Is it just well done? And I think we run into trouble when, like, for example, with ketamine, you do ketamine work, right? I've helped people get off of alcohol by using ketamine. And it's amazing to see people transform from drinking 2, 3 bottles of wine a day for 10, 12 years, and really, really sick from it, to going to use ketamine with a benzo taper process on this outpatient on the side, and then going in for regular infusions for, twice a week or once a week for several weeks. And all of a sudden they've stopped drinking and they've achieved total sobriety. And it happens. And it's through the ketamine and it's through the therapy and it's through the medical team that's supporting the person. A lot of prescribers are like, hell no, I don't know how to manage, like, what, they're on an SSRI and you want me to give them Ativan for their alcohol withdrawal, and we're trying to, and then we're going to give them ketamine. And like, a lot of people are just like, that's too much, that's too complicated. But if you have the skills, you can really help people. And of course, we have Ibogaine for opioid addiction. People are often administered now Ibogaine and 5-MeO DMT to help them get off of the stimulant use disorder or opioid use disorder. And that can really, jolt somebody out of a pretty deep addictive process by having these powerful psychedelic experiences. The question is, what support do they have on the back end? And I
Mhm.
really think that whether you're in recovery from addiction and you're curious about having a psychedelic experience, or you're in active addiction and you'd like to have a psychedelic experience to help you stop using or engaging with your addictive behavior, I think people really need to have supports and structures and systems around them to help them in an ongoing kind of way. It can't be just a one-off, oh, this is going to fix me, or I'm 30 years sober, I'm going to take a large dose of mushrooms and see what happens. It's like, no, probably not a good way to do it. You probably want to have some people that you're talking to and you're engaging with to support you in that process.
Can we focus that a little bit on ketamine just for the moment? And the reason I obviously have a vested interest in it because I do it. I'm a full-time ketamine clinician along with training and resources. But beyond that, it's also legal. Like, I know that we've got decriminalization and we've got a couple states, but mostly, people have to go to the underground. I mean, would you say that that's accurate?
Yeah.
And so kind of just focusing specifically on ketamine, I'm really curious because I said initially it was a hard no for me. And then what I began to witness and have consistently witnessed is that people don't come to me to get sober because that's not my primary thing. I will actually refer them elsewhere, but I will be part of the team. I've worked with a fair amount of people who kind of have an addiction in their back pocket, like a semi-functional, like, oh, by the way, now that I'm kind of stopped, I was actually smoking cannabis like every day, all day. Or, oh, by the way, you know how I told you I drank like 2 beers a day? Well, I actually drank like 8. And these kind of like almost spontaneous remissions
Mhm.
where people like I have a caseload that's about a third right now, what I call like accidentally sober. Like they didn't come to me for that. And that might also include like overeating. So I am seeing what I call spontaneous remission that I've now begun to work with more specifically of this like remission of overall kind of compulsive processes.
Mhm.
And I'm just kind of curious. Now I do all CAP. Like, so I do believe that it's different when CAP, ketamine assisted psychotherapy. So I'm just curious if you have thoughts about that. Like, what is working there? How can we make that even stronger? Any kind of concerns about that? Because I think you might have changed in your perspective too. Forgive me if I'm wrong, but I feel like I first heard you say, I don't know about ketamine. It might make people use more. But I might have heard that wrong.
Right. Well, I do think that in general, this is a pretty broad generalization, but I think that ketamine and MDMA in particular may have a higher misuse potential than, let's say, LSD or psilocybin or DMT or something. Um, and there's a lot of different reasons for that. But in general, again, if ketamine is offered in a supportive setting with the structures around it and the systems around it to help somebody process their experiences in the context of psychotherapy or group work or whatever, I think that it's the addictive liability is really low. And then in terms of like these accidentally sober or spontaneous remissions, what I think is going on there, and this is me, me going back to my 12-step roots, and I worked at the Hazelden Betty Ford Foundation for years, so I'm well entrenched in the Minnesota model of addiction recovery, and I'm a supporter and a believer in it. But the story goes back with Bill Wilson, the co-founder of AA, is that what is really helpful for people looking to overcome their addiction is a spiritual experience. Now, it doesn't have to be, I saw God or this massive like white light and the wind through my hair and, I was one with everything kind of thing. But we know with ketamine, people go to these places that produce profound shifts in their awareness, their emotional sensibilities, their constructs of who they are, and the different parts of themselves that they see during a ketamine experience. So that kind of shakeup, which is kind of spiritual in nature, is I think what's going on there for folks who are getting sober accidentally, that they're having such a profound
Yeah.
shakeup within their system that the familiar pathways that the addiction latches onto so that it can stay active in the system, they kind of disperse or they get sort of shuffled around, and the person isn't like, oh, I guess I don't need to drink tonight, or I guess I don't want that cigarette, that's weird, or like they wouldn't have thought that would have happened, but they just noticed that it's just not as compelling anymore, going down those familiar pathways in their brain so they can get their fix. It just doesn't seem quite as compelling for
Mm.
some people. It's
Okay.
definitely not a cure-all. You know this, Sandy. It doesn't help everybody. But there's a percentage of people who, like you said, either intentionally or accidentally find that their addictive behavior, whether it's substance or behavioral, it just doesn't seem that interesting to them anymore. They don't want to do it.
And that's a really good way of putting it. It just doesn't seem that interesting. But then I'm like, will remain eternally curious that it seems like there must be that like kind of drive towards doing it. For me, I suspect that there's some kind of shift in the default mode network and that we're working with the nervous system in such a way that it kind of like calms that compulsivity.
Mhm.
So yeah. I have had two people, so I've seen a lot of people. Like I do CAP full time. I do multiple sessions a week in all preparation and integration. So that's what I'm doing. But I have seen two people, perhaps three, maybe four, like two that I kind of lost track of that kind of went off the deep end and it actually did send them into addiction. Both those people had access to the medicine outside of the session. One had access to it recreationally, one actually had an at-home prescription. And I've given a lot of thought to what I could do to mitigate that. And I'm curious what your thoughts are, be it education, be it limiting access, be it like you said, building a whole system around it, good preparation and integration. What are your thoughts? And then we'll switch to 5-MeO.
Yeah, no, it's one that has evolved for me, that whole concept of at-home use versus in-office use. Of course, with intramuscular and infusion ketamine therapy, I guess someone could self-administer intramuscularly, but in general, when we think of intramuscular or IV use of ketamine in a clinical way or for therapeutic purposes, it's usually in the context of a medical office or a therapy setting, right? But the question is with lozenges. So lozenges are much more easily accessible and self-administered. And I was somebody at the beginning of my ketamine work where I was like, no, I think Mind Bloom is great. I think if you can call up and get a bunch of ketamine sent to your home and you can get access to it, and as long as you're connected to a therapist and they seem to have somebody who's there to support them through the process, that seems fine. Everybody should have access to this. It's safe, all this sort of stuff.
Or affordable. It's
Affordable, yeah, accessible. It's a patient's right. They shouldn't have to be restricted to doing in a therapist's office. That's too confining. It's too limiting, all that kind of stuff. And then over time, I've been like, people don't need to do ketamine that often. And if it means coming into the office once a week or for a little while, twice a week, you and I have done regular psychotherapy where someone's come in just for regular psychotherapy twice a week.
Right.
So coming in twice a week for ketamine, once a week for ketamine, I've sort of evolved towards like, I think it should probably only be done for most people until they're proven otherwise, I guess, until you're clear that they're stable and everything's okay. It should be done with the support of a therapist or a healthcare professional in the room with them. I think you optimize the experience. Also, the analogy I like to use with patients is, and I don't know if you've heard this before, but when a new movie comes out, it's a blockbuster movie, it's got all these sound effects and stuff, and you're like, I want to go to the theater and see that movie. I want to sit in the chairs, and you go there and you have this amazing experience, but then you're also like, well, I'll just wait till that comes out on Netflix. And I have a 70-inch TV and a great sound system, and I'll just sit there on my couch and watch the movie, and it'll be just as good as it's in the theater. It's like, no, it's really not, because you can pause the movie and get up for popcorn, or you need to go to the bathroom, or the dog starts barking or whatever. It's like, it's just not the same. So I say, like, that's kind of at-home ketamine use. It's like, it's just not the same. You're going to have a much more held, impactful experience if you're doing it like you're going to your therapist's office. Like, it's the setting for healing.
Yeah.
Your living room isn't necessarily the setting for healing,
Right.
So
it can be, but it's not intentionally so.
Right. Exactly. Exactly. So I've sort of evolved my thinking to, like, I think it's probably better if people are going to have a few ketamine experiences, to do them regularly within the context of a therapy setting first. And then if they're stable over time and they want to do maintenance doses at home, as long as they're in contact with their therapist saying, I think I'm going to do it Saturday night, I just want to let you know, we'll have an integration session within the next week or two to talk about the experience after they're stable. I think that's great.
Nice. I have begun to educate people about preoccupation, like if they have home use at all. I say, if you find yourself preoccupied with whether you should do it, or, you're supposed to do it on Wednesday, but maybe you'll just do it on Sunday. And is anybody going to be paying attention to if you, start to get the prescription sooner than you're supposed to? Like, that's the first sign, right? That you're going down the wrong way. And then you might want to get rid of it,
Yeah. And I can attest to, like, as a person in recovery from addiction myself, I've had 2 ketamine experiences as a person in long-term recovery, as part of my training. I wanted to have the experience because if I'm gonna treat people with ketamine in my office, I want to know what it feels like. And here I am, somebody who identifies as sober, no alcohol, no drug use, and I had an intramuscular ketamine experience that it blew my mind. I was like, holy moly. And it sold me on why this could be therapeutic for people, but it was really intense for somebody who hadn't used alcohol or drugs for such a long time. And then it was a year later where I had a lozenge experience, 300 milligram lozenges. And that was very profound too. But I also was honest with myself. I knew that this is way too convenient and this felt way too good. And I'm not using it because I'm depressed or I have trauma or anxiety or anything. If I were to use ketamine, it would simply be for personal exploration or recreation. And as somebody who identifies as being in recovery, I haven't used ketamine since that. That was let's see here, almost 3 years ago was my last ketamine use. And I've only done it twice because I know myself. I know that it felt really good. And if I had, a different mindset, I could be like, sure, Sunday night, throw in 100 milligrams. Oh, it's Wednesday and I need to relax a little bit more. Oh yeah, I'll do that.
Right. Nobody will know. It's just a little bit.
Right. Exactly. And I don't need to go there personally.
Well, and I think that kind of fits with what I was saying. I mean, and I think that's really good and useful information for people to have. Like, get really clear on what you're using and why and under what circumstances and who you are in the world and what your personal needs are.
Yeah.
So, all right, can we switch gears to F5MEO?
Yes.
So I witnessed again on LinkedIn, you kind of posted that you were doing a training, correct, on 5MEO and trauma.
Yeah.
And that was through, what is the name of the place? It starts with a T.
Yeah. Tandava.
Tandava, who I have seen them speak at various things and have been pretty intrigued by what they're doing. They seem like they know what they're doing and that they've got a lot of knowledge in this area. And so I'm just curious, what draws you to it? How has it impacted you personally and professionally? And I understand y'all are doing a retreat. So yeah, tell us about it.
Yeah. Next week, I'm going down to Mexico. I get to co-lead my first 5MEO retreat down there with one of the leaders who was, one of the founders and the trainers of this year-long trauma-informed 5MEO facilitator training program. So I did that all of 2023, mostly online. And then, and the reason why is because I learned about 5MEO DMT as being this like holy grail of psychedelics. We talk about regular DMT, that's NN-DMT, as the spirit molecule. So that's the active ingredient in ayahuasca, for example. There's two ingredients in ayahuasca, one of which is DMT, the other one is an MAOI inhibitor so that the DMT can last longer in your system. Otherwise, DMT is it's a very quick experience, but 5-methoxy dimethyltryptamine, 5-MeO DMT, is called the God molecule, supposedly. So the difference between the spirit molecule and the God molecule. So I heard about it and I wanted to learn more about it. I did this year-long training with these guys, Tandava, and their FIVE education, FIVE education program. And that culminated into 2 weeks in Mexico where 5-MeO DMT is legal. So I actually had the opportunity to do 5-MeO DMT several times at the end of my training. And these guys are really known for being very safe, very ethical, very cautious about the use of 5-MeO DMT. And their training protocol is everything about safety, 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 safety. And so I felt very safe and felt it was very professional training program. And we had the opportunity to use 5-MeO DMT several times in different formats. And it was indeed very profound. I went back in January because these guys had a partnership with University College London and Imperial College in the UK to do a study using 5-MeO DMT and measuring brainwave activity. So putting an EEG cap on your head and having a full release 5-MeO experience. And I was somebody who, when I've done 5-MeO DMT, I'm very still. Some people are very dynamic. They move around a lot, but I'm very still. So I was a good candidate for this study. So I had a full release.
You're not going to yank the EEG.
I didn't yank the EEG off my head. Exactly. Yeah. Yeah. So I can't say enough about this particular molecule, the training program that I did, that I'm going to co-facilitate the retreat next week. It's really a unique psychedelic experience, and unique in so many ways because it's short acting, it's extremely powerful, and therefore I think the caution and care surrounding its use needs to be of utmost importance. So to be trained and to be able to facilitate these kinds of experiences for people in Mexico in a legal setting has been really something that I've been very passionate about and I'm really excited about.
Do you think you need to be a clinician to do it? I'm just kind of looping back to the piece that you said that we talked about before. And then I want to hear more about how it's influenced you. So, but I'm just curious, like, is it for clinicians or is it kind of a broader, what are your thoughts on that?
I think it's broader. I think that clinicians who are psychedelic naive, they wouldn't know what to make of 5-MeO DMT. To see somebody flailing around and screaming at the top of their lungs or crying hysterically or seeming like they're completely broken and dissociated afterwards, all of which would send off alarm bells for any clinician worth their salt. But if you know 5-MeO DMT, you know that these experiences can happen and they're not necessarily bad, that you just work with people. In fact, a lot of people I've seen come out of what looked like a horrible 5-MeO experience, and the only thing they could report was nothing but wonder and awe and love and beauty. But in the meantime, they were screaming their heads off while they were on the 5-MeO DMT. So a complete opposite of what you think. So if you're a clinician and you see somebody ingest a substance and they start screaming their heads off, and you're freaking out because they're freaking out and you don't know what to do, and you should contain them or, quickly administer some sedatives so they can calm down or whatever. No, you let them be, you keep them safe. It's very quick. It's going to be over in 5-10 minutes or less. And when they come out of it routinely, they're like so filled with joy and gratitude and love and awe and wonder. It was the most beautiful experience of their lives, hands down. And so I think what's really important with 5-MeO DMT is to be well trained. Doesn't matter if you're licensed or not. You just need to know what this medicine does and how to work with it.
Oh, interesting. So I am curious on a kind of, personal / professional, wherever you want to put the balance, if there's a difference for you, because some people there is and some there's not. So you did this deep dive training with this medicine. How has it impacted you? Personally, professionally, like how are you different? Like what did you get out of it? Whatever you feel like sharing. I mean, obviously that's a deeply personal question, but
I mean, I think that in general, it's left me with a feeling more securely than ever that all shall be well, that all is well and everything shall be well. And despite all of the, and along with all of the chaos and drama and trauma and the insanity of what's going on in the world, whether it's natural disasters as you guys have faced, or political unrest, or the threat of war, or the climate crisis, is like it's that all of that is real and upsetting, and we must do what we can do to help each other and get through it. At the same time, there 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 is a possibility, and I feel like I've experienced it, that there are there is a perspective that can hold all of it in a much more fluid and peaceful kind of way. And to have had access to that perspective and to have that almost be part of my nervous system now is incredibly liberating and settling. It's very stabilizing in some way. That to feel like I have access to that all is well perspective at any time if I want to activate it. So I think it's really a valuable experience for people to have if they feel called to have the experience to get that kind of awareness lodged into your system is really it's really peaceful, and I'm super grateful for it.
would you consider it to be almost like a state? Is it more like a cognitive set, a state, like a physiological state in the kind of like Buddhist acceptance way? I'm just curious if like, can you name that like a little bit more? Like you say, it's like lodged in you. So I can extrapolate what that means to me, but I'm curious if you can just give us a couple more sentences about what that means. Because that draws from a lot of stuff. Like you call it the God molecule, right? I mean, like, is that God? Is that acceptance? Is that your nervous system is just so stable now that you can find that safety?
Yeah. I mean, we know from our psychedelic training that there's familiar um, takeaway messages that people get. It's pretty universal that people will say there's a sense of oceanic boundlessness, or this idea of paradoxicality, that we're seeing the paradox in everything. And the other concept is ineffability, that there's something ineffable about psychedelic experiences, that they're hard to describe. And So adding any more sentences to it, it's very, very difficult. There's an ineffability
Yeah.
to it. When I say lodged in my nervous system, it's an energy that I think was awakened, that is there, that was always there and is everywhere, frankly. But to have it be awakened in me, and should I choose to sort of close my eyes and meditate and drop into it, to have it accessible is really, I think it's very, very healthy and very reassuring and stabilizing. So maybe that's not the case for everybody, but that's the best way I can describe it.
Love that. That's beautiful.
Yeah.
So we're approaching the end of our time. And so, I'm just kind of curious, like, first of all, that is a great explanation. So rewind for a minute. Awesome. Thank you for that. That's super, super interesting. So if there's, one more thing or things that you'd like to share about yourself personally, like what might you like to share with the world or professionally, and or where do you see the field going, or where would you like for it to go? Like, what would you like to kind of end this with?
Well, I really like our conversation about what I call psychedelic sobriety.
Mm,
And psychedelic sobriety sounds like an oxymoron, or how can those two things go together? Because when people think of sobriety, they think of being sober. That means alcohol or drug free. So putting psychedelic and sobriety together seems like a misnomer, seems like it doesn't work. And
mhm.
I recently gave a talk to the Substance Abuse and Mental Health Services Administration, their Center for Innovation. They had me come in for a brown bag discussion, and I gave this talk on psychedelic sobriety, and one of the people said, that doesn't make any sense. There's no such thing as psychedelic sobriety because you can't have those two together. Sobriety means abstinence. That's it. And
Yeah.
the whole point of my talk was like redefining not necessarily what recovery from addiction is, but what is sobriety.
Mm,
And I like this idea of sobriety broadened out beyond just the alcohol or drug free definition, but more like the definition of sober minded, level headed,
mm,
balanced, nuanced, harmonious, a certain gravity. When someone says something is very sobering, there's a gravity about it, there's a seriousness of it. And so psychedelic sobriety to me is something that I'm working on developing ideas and materials around to help people who may have a very entrenched view of what sobriety or recovery from addiction is. And it isn't simply a harm reduction mentality where, you might use safe consumption site or clean needles, or you might take methadone or buprenorphine, or you might have fentanyl test kits, like anything we think of in terms of harm reduction. That is a model to help people stay alive. And it's a
yeah.
valuable one, but that's a specific model. And then we have the abstinence based model: no
Mm,
drugs, no alcohol, under no circumstances, anytime. And that's really helpful for some people as well. But then
right.
there's like this blend of the two. Like where do we integrate some harm reduction principles with some of the lessons and learnings from an abstinence-based model, and can they come together harmoniously in this idea of psychedelic sobriety? So that's
Mm,
something I'm really working on over the next year or so. I'm going to be focusing a lot of my attention on trying to develop some more talks around this and maybe some written materials, because I think people have a lot of questions about how does this actually work? Can somebody use a psychedelic to get sober? Can somebody use a psychedelic to maintain sobriety? Can somebody use a psychedelic who's already been in long-term recovery from addiction? And the answer is yes.
mhm, mhm. Yeah. Well, I absolutely love that. And I look forward to all of those things because I too think it's really, really important. Clients that I have that really struggle with, can I use this? Should I use this? What if I like it? Is that bad? And just all of that. So I'm grateful to you for being a voice for that and for, leading the charge to educate the rest of us too. So, how can people find you? You have a private practice. You're part of the Vermont Psychedelic Society. You have this conference that I I don't know if you plan to do it again, but it's lovely. And you're leading these retreats. So how do people find you if they want to learn more about you or access what you have available? How do they find you?
Well, the best way to reach out to me is probably over social media.
Uh-huh.
I'm pretty active there and pretty responsive. Emails and stuff don't work really great. In my website, I've got a couple of different ways people can reach out to me over different websites, but in general, it's really social media, whether it's Twitter X or Blue Sky now, and LinkedIn, obviously, and Instagram. So those are the ones that I'm most active on. So, you could search my name on there and reach out to me over those.
Great. Well, I want to thank you, just heartfelt thanks. I've really enjoyed this and really appreciate your time and appreciate your wisdom and expertise and all that you're offering, not only in this, but to the world. So thank you for your leadership in this space.
Thank you. And thank you for coming to Vermont 2 years in a row, all the way up from North Carolina. And I hope to come down and visit you down there sometime.
Yes, please do. We can take you on a disaster tour as well as a non-disaster tour.
Good.
All right. Thank you so much.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.